So now we are going to continue our discussion on the brainstem. We have already discussed about the rule of 4. Now that is the continuation of that, and we will see the ventral and the dorsal aspect of the brainstem. So firstly, they are telling us about the ventral view. On the ventral is basically the anterior side. If we are looking anteriorly on the brainstem, there will be 4 cranial nerve above the pons, right? Remember that cranial nerve 1 and 2 are not a part of the brainstem. They are emerging from the brain parenchyma above the brainstem. So, but they are still above the pons. That is, convenient to speak it like that. That there are 4 cranial nerves above the pons. That makes the rule of 4 very handy. So, 4 cranial nerves are present above the pons. Cranial nerve 3 and 4 are coming out of the midbrain, while 1 and 2 are from the brain parenchyma, brain substance above the level of brainstem. 4 cranial nerves exit the pons, that are cranial nerve 5, 6, 7 and 8. 4 cranial nerves are in the medulla, that are 9, 10, 11 and 12. And 4 cranial nerve nuclei are medially located, that is cranial nerve 3, 4, 6 and 12. All of them are motor nuclei, and these are, in the rule of 4 we had talked about factor of 12 except 1 and 2. So 3, 4, 6 and 12 are the factors or multiples, not multiples, they are factors of 12. So because I hope you understand the maths. So they are the factors of 12, and these factors of 12 nuclei are present centrally except 1 and 2, because 1 and 2 both of them are present above the brainstem. So their nuclei are supposed to be present above the brainstem as well. Now if you look at this diagram, we'll first see this side and then we'll go to that side. First thing they've shown you is the olfactory bulb, that is cranial nerve 1. Cranial nerve 1 is basically an atypical cranial nerve. I call it atypical, it is not atypical in fact. The point of atypicalness in this cranial nerve is that firstly it is a part of the brain substance. Secondly, it is not like a tubular nerve, something like that. It emerges like there are multiple fibers which are passing through the cribriform plate, and then they fuse together in the form of an olfactory bulb. Then there is an olfactory tract that is going back. So this is something atypical for a nerve to do. Then olfactory tract is present behind the olfactory bulbs, that is also a part of the olfactory system. After that we have cranial nerve 2. The cranial nerve 2, and you must remember that the olfactory nerve does not relay in the thalamus. Cranial nerve 2 is the optic nerve, and this is a cut section of the optic nerve. Optic nerve actually goes from the anteriorly through the superior orbital fissure all the way to the globe of the eye and stuff like that. So this is optic nerve, and behind the optic nerve, when the two optic nerves fuse together and the nasal fibers decussate, the point is called as the optic chiasm. Here they have written optic chiasm. So this is optic chiasm, and behind the optic chiasm we have optic tracts. These optic tracts. Then cranial nerve 3 is called the oculomotor nerve. This is the motor supply for the extraocular muscles. The cranial nerve 4, that is the trochlear nerve, that arises dorsally and immediately decussates. The only cranial nerve to emerge or to originate on the dorsal aspect of the central nervous system, or the dorsal aspect of the brainstem, is the cranial nerve 4. Then we have trigeminal nerve, the abducens nerve, facial nerve and the vestibulocochlear nerve. All of them are coming out of the pons. The 4 nerves to come above the pons are cranial nerve 1, 2, 3 and 4. 5, 6, 7, 8 is coming out of pons, and cranial nerve 9, 10, 11 and 12 are coming out of middle. As you can see in the picture as well, actually the picture is kind of confusing, but you must remember the rule of 4. So cranial nerve 9, glossopharyngeal, vagus nerve and the accessory spinal nerve along with the hypoglossal nerve, they are coming out of the medulla. Now let's move to the other side of the diagram. Here they have shown the optic chiasm, which we have already seen. Then there is an infundibulum. Actually this is a very very hazy diagram for the infundibulum. Infundibulum is a structure that connects, suppose this is hypothalamus, then we have this infundibulum stalk, and we have below that we have the pituitary. So this infundibulum is a connection between the hypothalamus and the pituitary. So actually this diagram is not very clear for the infundibulum. The next point is mammillary body. Mammillary body is a part of limbic system, and do you remember in which disease mammillary body is damaged? There is a disease that we call Wernicke-Korsakoff syndrome, and in the Wernicke-Korsakoff syndrome, that is due to the thiamine deficiency, we have loss of we have damage to the mammillary bodies. Then there is pons. After that we have the middle cerebellar peduncle. The pyramids are present over here. The middle cerebellar peduncle connects the pons to the cerebellum. So there is a thing that I have an analogy for that. If I draw the brainstem like this, suppose this is the midbrain, then we have the pons and medulla, and that goes like this, and this is the cerebellum. The midbrain is connected to the cerebellum via superior cerebellar peduncle. The pons is connected by the middle cerebellar peduncle and the medulla is connected by the inferior cerebellar peduncle. So the three levels of the brainstem are connected through the respective peduncles to the cerebellum. The next thing is about the pyramidal decussation. Now what is pyramid? If I draw a medulla like this, suppose this is medulla, the outer medulla is divided into four subparts. The outer parts are called olives and the central part are called as pyramid. So O is for olives and O is for the outer. So you must remember that olives are located outside or more laterally, while the pyramids are positioned more medially. And just below the pyramids we have the decussation tract for the corticospinal fibers. The corticospinal fibers are the upper motor neurons that are coming all the way down below the pyramids, and then they decussate to the opposite side just below the pyramids, and that is depicted by this line over here and they are calling it pyramidal decussation. Then there is C1, that is the first cervical peripheral nerve that is coming from the spinal cord. So this is the diagram. Now let's move forward. Over here, I'm sorry. Now they're telling us the dorsal view. In the dorsal view, we have to identify some salient structure. The very first structure that you must be able to identify is this egg-like structure that is called as thalamus. The second structure just behind the thalamus is the third ventricle over here. This is the third ventricle. Then we have the superior and inferior colliculus, which are parts of the midbrain, right? The pineal gland is present on the dorsal aspect of the brainstem. It cannot be I don't remember what is it called. I don't remember. There was another name to pineal gland, but pineal gland is situated on the dorsal aspect of the brainstem. Then we have superior cerebellar peduncle, the middle and inferior cerebellar peduncles. After that we have the anterior wall of the fourth ventricle. Then we have the medulla, and now let's move forward to this diagram. I guess this is a picture from the Uworld. This is same picture as the one we have just discussed, but let's see it. So these egg-like structures are thalamus. Then we have the infundibulum and the pituitary stalk. After that we have the mammillary body as part of the limbic system. So don't get confused on this diagram, because right now we are talking about brainstem and even the dorsal aspect of the brainstem, right? And the pituitary, as you know, is situated very anteriorly into the brain, like just in the sella turcica, that is a part of the midbrain. So the diagrammatic orientations can be confusing at times. You may be confused at why the pituitary is drawn in the dorsal diagram of the brainstem. So this is a three-dimensional picture, and you need not to be confused about this, not at least for the step 1 exam, right? Because in the step 1 exam the diagrams which they give you on the paper are very easy, they are very convenient, and they are not confusing at all. So don't get yourself confused on this picture. Now let's move forward. This is the cerebral peduncle or the crus cerebri. They are part of the midbrain. Then here we have the pons. After that we have the middle cerebellar peduncle. Then the olives are located outside, the pyramids are located centrally. Then there is pyramidal decussation just below the pyramids. After that we have the optic chiasm. Okay, good picture for the optic chiasm. This is the optic nerve. This is the optic nerve, and both the optic nerves combine together to form the optic chiasm. Then optic tract is emerging behind the optic chiasm. There is an oculomotor nerve, that is cranial nerve 3, that is emerging from the midbrain. Then the trochlear nerve coming from behind the midbrain. Trigeminal nerve, the abducens, facial and vestibulocochlear nerve, all coming out of the pons. Glossopharyngeal, hypoglossal nerve, vagus nerve, and the spinal accessory nerve coming from the medulla. Now this is the diagram which we already have seen. Now let's move forward to this pineal gland thing. Pineal gland is responsible for the secretion of melatonin and secretion, and they are responsible for circadian rhythms. Superior colliculi direct eye movements to stimuli noise, movements or objects of interest. Inferior colliculi are responsible for the auditory sensations. So superior and inferior colliculi, as we have seen in this diagram, they are part of the midbrain. Superior colliculi are for the visual system. They are concerned with the visual system. I guess the visual reflexes are coordinated in this thing, but forget about that. Visual system, the superior colliculus is a part of the visual system, while the inferior colliculus is a part of auditory system. How can you remember that? If I draw a face over here, it is not a very good mnemonic to say the least. Suppose this is the face and these are the eyes, and we have ears below the eyes. So if you see your own ears, you will find that ears are slightly below your eyes. So superior colliculus is for the visual system, and auditory system is concerned with the inferior colliculus. Now let's move forward. So your eyes are above your ears, and the superior colliculus is above the inferior colliculus, that is auditory. The next point is about the acoustic neuromas or schwannomas. So the acoustic neuromas or schwannomas commonly located at the cerebellopontine angle. Okay. What is cerebellopontine angle? Suppose I draw a midbrain like this. This is midbrain, then we have the pons and medulla, and this is like that, and behind that we have the cerebellum. Now you can see that there is an angle if I change the color, like maybe this one. So this particular angle that is between the pons and the medulla, this is a sideways diagram. If I draw frontal diagram, that's not called frontal, but if I draw a diagram from the anterior side, so this looks something like this. This is midbrain, then pons and medulla, right? And behind them we have cerebellum. That looks something like this. Like this is cerebellum located behind the midbrain, pons and medulla. So the angle that is formed over here, there will be an indentation between the cerebellum and the pons, that is called as the cerebellopontine angle. And this is the most common location for the presence of schwannomas. Now let's move forward. Here you can see that acoustic neuromas commonly located at the cerebellopontine angle arise from the cranial nerve 8. The presentation is ipsilateral sensory neural hearing loss, tinnitus and vertigo, that is cranial nerve 8, loss of facial sensation, cranial nerve 5, and facial paresis. Now whenever there is a what is that called, space occupying lesion, whenever there is SOL or space occupying lesion in the brain, the deficits depend on the area that is being involved by that space occupying lesion. Now if I am talking about schwannomas, schwannomas are present mostly at the cerebellopontine angle. From the cerebellopontine angle we have a lot of cranial nerves that are emerging, right? In that close vicinity we have trigeminal nerve. If trigeminal nerve is affected, we will have a loss of sensation from the ipsilateral side of the face, right? If we have damage to the if we have damage to the trigeminal nerve, cranial nerve 5, we will have loss of facial sensation. If we have loss of facial nerve, that will lead to loss of facial movements on the ipsilateral side of the face. And if we have an effect on the cranial nerve 8, there will be disturbance of the hearing and maybe balance as well. That is, tinnitus and vertigo will also be seen. Bilateral acoustic neuromas are associated with neurofibromatosis type 2. This is a disease which we will study later on. Now let's move forward to the cranial nerve nuclei. Now wherever is the location of the nerve, the same is the location of the nucleus, because you know that nucleus is the site of entry of emergence of the nerve, right? So if I am saying that the cranial nerve 3 is present in the midbrain, so is the nucleus, right? So nuclei and nerves are present together. Just follow this rule of thumb and things will be very easy for you. Located in the tegmentum portion of the brainstem between the dorsal and ventral portions. In the midbrain, the nuclei are cranial nerve 3 and 4. The pons, the nuclei are cranial nerve 5, 6, 7 and 8. So this is going very smoothly. Now in the medulla there is an exception. There cranial nerve 9, 10 and 12 nuclei are present in the medulla, while the accessory spinal nerve nucleus is present in the spinal cord. Now about the accessory spinal nerve, suppose this is midbrain, pons, medulla and then spinal cord is just below that. The spinal accessory nerve is basically has two components. One is the spinal component and second one is the medullary component. So the nucleus is present in the spinal cord. From here the fibers ascend upward into the medulla and then come out as the medullary portion of the cranial nerve 11. And there is also a spinal portion. Both the spinal and medullary portion then move together. So this is a peculiarity about the accessory nerve or the cranial nerve 11. The lateral nuclei are sensory, that is Eller plate, because the Eller plate is, what is Eller plate? If I draw brains, spinal cord like this and there is a central butterfly and this thing. So these plates which are located, so these plates are the Eller plates which are sensory, and the plates which are located ventrally, they are called as the basal plates and they are motor. So just to remember, just to make a mnemonic, the lateral nuclei throughout the brainstem will be sensory in nature, right? I don't know what sulcus limitans is, but sensory nuclei are located on the lateral aspect. The medial nuclei, they are present medially. The motor nuclei, they are present medially and they are coming from the basal plate. The next thing is about the cranial nerve vessels and pathways. So the nerves and vessels, pathways. So this table is important and you must remember the openings and specifically the structures which are coming out of those openings. So the very first opening that is present in the anterior cranial fossa, the only opening that is present in the anterior cranial fossa that is of significance is the cribriform plate. The cribriform plate is a part of the ethmoid bone, and through this ethmoid bone fenestration we have cranial nerve 1 or the olfactory nerve fibers which are coming into the cranium, and then they fuse together to form the olfactory bulb, and then olfactory bulb goes backward as olfactory tract to the temporal lobe for the olfactory cortex and stuff like that. And the only thing that you must remember, I guess that they're going to audit temporal lobe. I'm not sure, but I'm kind of sure they go to the temporal lobe. Kindly check that out. So the anterior cranial fossa has cribriform plate that contains cranial nerve 1. Then we have the middle cranial fossa that contains the optic canal, superior orbital fissure, foramen rotundum, foramen ovale, and foramen spinosum. So from the optic canal we have cranial nerve 2 and ophthalmic artery that is going to the globe of the eye. Then we have superior orbital fissure. Now in the superior orbital fissure, before doing anything else, I just want to tell you that the trigeminal nerve or the cranial nerve 5 is subdivided into V1, V2 and V3. The V1 is called the ophthalmic nerve, V2 is the maxillary nerve, and V3 is the mandibular nerve. All three are parts of the trigeminal nerve. Now each division of the trigeminal nerve is coming out through a different foramen, and the mnemonic for that is standing room only. You may think that cranial nerve 5 has standing room only. So cranial nerve V1 comes out of superior orbital fissure. The V2 is coming out from the the V2 is coming out from foramen rotundum, and V3 is coming out of foramen ovale. Right? Now let's see that. Superior orbital fissure. This thing is superior orbital fissure. This thing. Superior orbital fissure houses cranial nerve V1 along with cranial nerve 3, 4 and 6. The cranial nerve V2 is coming out of the foramen rotundum, as you can see in this picture, and the third thing is about the foramen ovale that is present over here. The middle meningeal artery that is present in the foramen spinosum. It is very important that the foramen spinosum does not contain any nerve, and a thing of significance that is present in the foramen spinosum is the middle meningeal artery. And do you remember that the damage or laceration of the middle meningeal artery will lead to what? That will lead to epidural or extradural hematoma, that is a lens shaped hematoma that can cause devastating consequences. Then we have posterior cranial fossa through the temporal, or now remember that these openings, superior foramen rotundum, ovale, spinosum and optic canal, all of them were present in the middle cranial fossa and they were passing through the sphenoid bone. The posterior cranial fossa, that is through the temporal and occipital bone, they contain internal auditory meatus. In the internal auditory meatus, there are two cranial nerves, which are cranial nerves 7 and 8, which are passing together. So, if I draw, pons over here. So, suppose this is pons, a very humble picture of pons, and then we have the internal acoustic meatus over here. Suppose this is the sixth nerve nucleus that is giving rise to sixth cranial nerve, right? And